Hello, everyone. I think people are being let into the webinar right now. If you have joined, thank you for joining. Good afternoon. Welcome to What's Your Data Path? This is the first in a series of webinars that we are holding with data scientists to learn more about careers in data science. My name is Jo Louie, and I work at the nonprofit organization Education Development Center, or EDC, based outside of Boston, Massachusetts. I'm the director of Data Paths, which is a multi-year project funded by the state of Massachusetts to promote interests and skills in data science among students in grades K through 16 throughout the state. Next slide, please. The Data Paths project consists of a team of people who are providing an array of professional development learning opportunities and curriculum materials for teachers to integrate more data science practices into their current teaching. We're also developing an online career hub, including a suite of resources to help students learn about data science careers. This webinar is the first in a series that we'll be holding over the next year and a half to talk with professionals working in a wide range of fields and who use data intensively in their work. For those of you attending live, our goal is to inform and potentially inspire you to share information from today with young people who may be interested in pursuing or learning more about data analysis careers. We're also, as you've heard, we're recording this session and aim to place on our project website the whole hour-long interview or clips that people can view again or share with other students or learners in classrooms or in out-of-school settings. Next slide, please. So here's our agenda for the next hour. We'll have two guest speakers present about themselves and their work, each for 10 minutes. The first speaker, Heather DiGregorio, is a researcher at Emory University. The second speaker, Christian Casanova, is a data and AI strategy consultant at the company Accenture. I'm not going to say too much more because they'll introduce themselves. After they speak, I'll jump back in to have a brief discussion with the presenters, and then we'll open up the webinar to take your questions. Now, just to note, all participants are muted during this webinar, but you can pose your questions in the Q&A box that's at the bottom of your screen anytime during the session. This is different from the chat box, which you can use to chat with any of us on the Data Paths team or with each other. Now, for this session, I want to acknowledge Jen Stiles. She's a member of the Data Paths team who is working the slides and technology aspects of this webinar, all behind the scenes. And she and another member of the Data Paths team, Johanna Nicola, will also be helping to monitor your questions as they come in, so we can read them to the speakers at the end. So that's how it's going to work. Next slide, please. And now we'll turn it over to our Data Paths speakers. So how about we go first to Heather DiGregorio. Go ahead, Heather.
Thanks, Jo. Thank you to the Data Paths team for inviting me to speak today. I'm very excited to talk about some data. So hi, everyone. My name is Heather DiGregorio, and as Jo mentioned, I work in research at Emory University. You can go to the next slide, Jen. So to begin, how I got interested in research was really through my own athletics. So up until a few years ago, I was a pretty competitive horseback rider for most of my life. And from that, I have suffered a few concussions in my days. And around the time of one of my worst concussions, the whole concussion in football conversation really started to ramp up. And I'm also an avid football fan, so it was really cool for me to kind of be hearing about these stories and also have something almost relatable in a way, or it felt relatable at the time. So when I went to college, I went to the University of Georgia where I studied psychology, and that was where I got my first experiences with data as a volunteer research assistant collecting EEG data in an emotional processing lab. I knew that I really enjoyed the research aspect, but I did also know that I really wanted to move into the sports medicine kind of side of research. So after graduating, I started working for a research study called the Football Players Health Study at Harvard University. And there I had a really great opportunities to learn about all areas of developing strong and sound studies and grow into a researcher. So I started there as a data research assistant, and I had very minimal experience when I started, especially in coding and really being hands-on with the data. But with great mentors, I moved from kind of like a plug and chug data entry person into survey development and data analysis as an epidemiology research assistant. Working at Harvard, I also had a great opportunity to get my master's in psychology at Harvard while I was working full time. And this was an amazing way to combine my work and my school with all of the projects and papers that I was doing. And that kind of combination of passion and education really kept me motivated and excited. And has inspired me to pursue another degree, hopefully either a PhD program or potentially medical school. So through a connection with the Football Players Health Study, I actually just started a new job at Emory last week in a sports cardiology lab under Dr. Jonathan Kim, who's kind of one of the founders of this subspecialty field of sports cardiology. He works as the team cardiologist for all of the professional sports teams in Atlanta and is one of the leaders in creating policy and guidelines for this specialty field of sports cardiology. Already working for him in a short time, I've been able to see how data can really impact people's lives and enforce positive change. And I'll show an example of that towards the end. But the work I get to do in Dr. Kim's lab is mostly focused on understanding the cardiovascular impacts of sport in collegiate and what we call masters athletes, who is any athlete over the age of 35. So next slide, please. So to take you through the areas of research that I work in and use data in typically, I just want to take you quickly through a life cycle of a research study. So what's in red are the phases of a study that I have worked on or still work on in this new role, and all of these phases really use data. And I really want to emphasize that point that in each of these phases, we're always thinking about the data, even if we're not exactly working on it in that moment. So what kind of data will answer our research questions? How can we improve the quality of data so it's more usable in analyses? We're thinking about these things through the whole way. So starting with study design, this is where a lot of collaboration happens. And in my areas, working with the Football Players Health Study, I did a lot of work with surveys. And there we would decide as a team what questions we needed to answer our questions. So what data do we need to test our hypotheses? Once we've answered those questions, I'll go into this awesome tool called REDCap, build the surveys, other data collection forms, always again with the data back in the back of my mind. So for example, if I want to know about a participant's year of birth, I'm probably going to choose to present that to them in like a drop-down option of numeric values rather than a free text field where they could put in some funky characters that I'm going to have to clean up later. So then we go into recruitment, and there's two really important things that I've typically used data for in the past with recruitment and think about data with. So first, we need to develop the recruitment plan. Who do we want to invite and how? And of course, it's really easy to introduce bias when recruiting for research studies. So we need to keep in mind what kind of conclusions we hope we'll be able to make with the data we eventually collect. And so our questions kind of are, will we want to generalize our findings to the entire population, or do we want to say something about a smaller subgroup? Are there ways that we can analyze the data later to mitigate any bias we do introduce? Other recruitment data that's really valuable are things like tracking communication, so we can see how many touch points it takes to get to a survey completion. And then we can also create really nice graphs and charts and things to be able to visualize who is engaging with what type of content so that we can improve our email and social media outreach. Then the fun part, or what I think is the fun part, is collecting the data, cleaning it, and analyzing it. I really love this because this is when we get to answer what is hopefully a novel research question, and I find that really rewarding. I felt very lucky working at FPHS, the Football Players Health Study, especially as a younger professional, because they allowed me to get very hands-on with the data even before I really knew what I was doing. So being trusted to explore our databases, ask questions, dive into analyses was really what allowed me to get comfortable with data and improve my statistics, both for the benefit of school when I was working on my master's program, but then also so that I could keep up with the stats conversations and contribute to them when we would meet as a team to discuss those plans. And of course, after the data cleaning and analyses are done, we get to communicate what our data told us through manuscript writing. This is also a favorite aspect of research for me because I get to write about why my question was interesting, what my data say, why are my data important to the scientific community. And specifically at the Football Players Health Study, they are what we call a community participatory based research model. So we would also provide the findings that we write in a manuscript in a simpler, more easy to understand fashion, include some actionable steps, hopefully, for their health, and then provide those back to the community. And I really enjoyed this because I got to contribute to the scientific world while also providing something meaningful back to the community who we were studying, who gave their time and their data to us, which we were really grateful for. Next slide, please. And to finish up, I just wanted to quickly take you through what I think is a really cool example of data making a real tangible impact in health. So this study is from Dr. Kim's group, and it's known as the RACER study. They looked at the incidence and outcomes of cardiac arrest associated with marathons and half marathons in the United States. So this first paper of two was published back in 2012. And they really just wanted to know what were the rates of cardiac arrest and death in marathon runners. Excuse me. And they found that in races from 2000 to 2009, there were 59 out of 10.9 million runners had a cardiac arrest on race day, and 71% of those arrests led to cardiac deaths. They also found that the initiation of bystander administered CPR was one of the strongest predictors of survival, and this led to Dr. Kim and others really making a big push to create policies which now mandate CPR training for certain marathon workers and AEDs at specific mile markers at long distance running competitions. And that's even over the years has moved into all kinds of sporting events. Next slide, please. And then this second paper was published just a couple months ago, and I was lucky enough to be on this paper. And it was pretty much just a follow-up to see if anything has changed since those mandates were introduced. And so this study, again, looked at the incidence and outcome of cardiac arrest in marathons and half marathons from 2010 to 2023 to see if anything has changed. And the short story is yes. Although the rate of cardiac arrest stayed pretty consistent, there was a significant decline in cardiac death incidence, and the case fatality rate dropped from 71% to 34% in the years after implementing these rules. So I think this is just a really great example of how important understanding data is and how it can inform real impact in areas like health and quality of life. So I'm looking forward to everyone's questions and speaking a little bit more about my work in data. Thank you.
Great. Thank you so much, Heather. I hope people can hear me. That was really rich. Why don't we move on to Christian? Go ahead, Christian.
Thank you, Joe. And amazing to learn about your work, Heather. Hello, everyone. My name is Christian Casanova. I am, you can go to the next slide on I get to share a little bit about my journey and a little bit about what I do. So I am a enterprise AI strategy consultant with our data and AI group at Accenture. Accenture is a professional service company that helps provide businesses on how they can best leverage analytics and artificial intelligence to solve their business problems. In essence, so I specialize in helping drive strategic decisions and being able to leverage data to improve and transform initiatives in which they're hoping to achieve to either streamline operations or rethink on how they can rethink their purchasing strategy or how they can better leverage data from their IT departments. So very few examples, and I will go over a little bit after. So my journey to where I am now is a very long one. In my undergrad, I studied sociology and political science. So my background is really into the social science space, and I really grew in love and learned about what it meant to understand social behavior. How can we leverage data on understanding inequities in healthcare across different communities, like such as Detroit? When you think about social determinants of health and health disparities across different marginalized communities, as one example. Over the course of my career, I have done an internship at the CDC with the University of Michigan, which I ended up doing my master's in health informatics, focused on healthcare data management, and being able to also do a second master's in public policy to kind of understand the intersection between how can we make better data-driven decisions, but also how can we make policy that would essentially be able to help us understand the impact of data when it comes to our day-to-day life. Over the course of my journey, I also was a part of the City Year AmeriCorps program, where I was in San Jose doing sixth grade math and social studies support for tier 1 and tier 2 to fellow teachers. Wasn't my journey in terms of me becoming a teacher, but it was a great experience for me to understand what it meant and what kind of impact I wanted to make in the world. And so if you can go to the next slide. Oh, also in these pictures is just a couple of pictures of me and my travels, and a couple of the teams that I've had the pleasure of working with over my time throughout my professional career. And my kiddos over there are up there as well, who were my sixth grade students back then. You can go to the next slide. So here's where I kind of will share sort of my typical day-to-day on what I do and what how I leverage data and AI. And so to start us off, if you can go to the next slide, it's sort of where a lot of where my expertise and my ability to provide value to the clients that we work with sort of follows some of the data solutions that I've been able to build and provide. And this is something that we always consider as an iterative process. As we think about some of the big issues that they have around data, some of our approaches that we have been able to do, and I've always leveraged, is being able to understand how we can understand their problem from a fundamental standpoint. So how do they want to approach patient growth at a health system? How do we understand that problem, and what kind of data are they leveraging to be able to answer that problem and be able to challenge that problem, and how they can be able to ultimately scale on how they can be able to on that solution itself. And that requires a lot of processes in which comes with data preparation. So I have been involved in data cleaning or data manipulation, which is a course and an important aspect of some of the work that we do. A lot of clients, a lot of businesses have a lot of messy data, a lot of messy systems, and often a lot of convoluted systems that require a lot of navigation, as well as being able to leverage visualizations. So this would be like dashboards, essentially tables that would be able to provide a visualization, which I will provide as well later in one of my examples, on how we can improve people's understanding of data once it is being cleaned and being analyzed, which also includes how can we leverage data science or machine learning, and being able to leverage all three to build a data product that would essentially help the people, customers, consumers, the list goes on how they can best use that application or product to the best of their abilities, whether it's helping a CEO make a decision on how to run their business, to a consumer on how to purchase the next item in a much easier or personalized way, as one example. If you go to the next slide, I will kind of jump into sort of an example that I've been able to work with to kind of contextualize some of the work that I've been able to do. So one of the projects that I've worked on, if you look at this picture, is a New York building. And part of the challenge of one of my clients was understanding how can we help essentially be able to green-proof some of these buildings in New York, and how can we help them support on how they can be able to hire contractors to be able to install such products for customers, so that one, they don't have to pay increased taxes on New York City policy on carbon emission, but also how can they reduce their overall carbon emission to make sure that they're meeting their sustainable development goals as well. And so part of, and ultimately being able to understand how was their return of investment. Part of my role and my work is to understand the way that they do work and how they do business. So in utilities, for example, one of the ways that they make money is not really how much they charge you for electricity, but it's really how much can they reduce cost in terms of the electricity that they provide. So one of the ways that I try to help them understand is to be able to leverage data, their internal data and their public data, to be able to make stronger decisions around how they can be able to target individual buildings such as this, and how they can be able to um, identify and better identify customers that are eligible for their programs, and being able to scale that up across the entire 5 boroughs in New York City. So if you go to the next slide, oh, that's weird. Okay, I must have hidden the other side. Sorry, if you could go back. So part of the solution that we went to is essentially being able to support on how can we build their data strategy. So what kind of systems are they working with to identify which buildings are trying to identify particular clean energy programs? So do they need a heat pump? Is there a program that's running for that? Where is that data being collected? Are we analyzing and are we looking at each individual customer to make sure that they are eligible from a subset of criteria that has been set by the business? My role is also to help them understand what are they actually working with. A lot of businesses don't know what they're working with on a day-to-day basis. A lot of folks will have contracts with individual Microsoft products or the Google products, and then people have a misconception that they don't talk to each other, and they often don't. And part of my role is to help them sort of understand what they're working with and what is the best way they can leverage the technology that they're using, which ultimately is being fed by the data and being able to make decisions out of that data. And ultimately, I help them build a model that will be able to essentially help them identify buildings in which are eligible for 10 programs across their business, in order to reduce their carbon emissions by at least 30% across over the next 3 years. So that's sort of like the type of work that I've been involved with. If you go to the next slide, which gets a little bit more into sort of like the type of work I really love to get involved with and enjoy, is one of the pieces of work that I've been able to do is being able to help the Department of Public Health here in California achieve vaccine equity by leveraging the data that they've collected across the pandemic. As you know, we've all lived through it, in order to understand how they can best allocate the vaccines being received by the CDC, but as well as how much the state had ordered throughout the pandemic to make sure that the state is getting properly vaccinated. So and these are all publicly available dashboards. You can find it on their website. But at the left dashboard is something that I helped build with the team, data and AI team that we set out to support on providing this information for public consumption, but as also for research purposes, being able to understand how many people are being vaccinated across the county. From the demographic standpoint, what is the impact of communities being vaccinated throughout the state, and which clinics need more support or more vaccines based on demand. Part of achieving vaccine equity is understanding how we actually manage the supply chain, meaning that how we actually managing the number of vaccines and how do we actually distribute it properly. So on the right side, you have something that we've been able to leverage data for on a social network graph, which I know Heather is an epidemiologist as well. So part of this is in leveraging data to make decisions around demographic data points on connections on where there could be a probability of uptick of particular COVID outbreaks in particular communities in California. So this data science technique essentially tries to predict on what kind of characteristics can we best leverage to be able to make public health informed decisions on how we can appropriate vaccines across different communities in California. And so this is something that we work to build with the epidemiologists at the public health department to be able to leverage data to the fullest extent to ultimately save lives throughout the pandemic a couple of years ago. If you go to the next slide, and then kind of go into a framework that we've built as well in terms of how do we achieve health equity. And this is something I found very important. And in the space of data, my background in sociology and political science helps me think about also how are we leveraging data to make sure that we're making ethical decisions and responsible decisions around the models that we're building, around the models, algorithms that we're building. And it's very important for people who are leveraging data and who are using data to understand what it means to have bias, what it means to ask the right questions around how we can better provide, be leverage, and being able to understand the outputs on how we use some of these models. And this is some of the great work that I've been able to do when we're thinking about health equity, right? There's so many things that go into achieving vaccine equity and being able to achieve proper health equity across times like a pandemic. Who gets to receive the vaccine? How many communities are being vaccinated? How we can best reach them throughout certain times of crisis like this. If you go to the next slide, I kind of go into, see, that's where you can skip this one. So I kind of wanted to go into, why I do what I do. And part of my journey, as I highlight in the next slide, is I've been able to experience a lot of work across either health research and being able to leverage a lot of my social science background, where I've been able to use that to make models to inform CEOs, inform CIOs about how they can best use data in a way that helps the community, but also being able to help their business and how they can achieve their sustainability goals, or how can achieve health outcomes or health policies that has been set up at the state. And I've been very proud to be able to work in the space where I've been able to merge between the work that I do in data strategy, which is very important as fundamental, right? You need to know what you want to use the data for. Data science, and being able to leverage models and being able to build analytics outputs and products, but also, and by products, I mean, items and things that people can leverage, and at the overall, how to make those ethical. So I've always considered this to be a very long journey, but I think it's always a great combination where I've been able to bring in a lot of my social background to my data background and being able to augment that to such an extent and bringing that full front to the work I do at Accenture. Thank you.
Wonderful. Thank you so much, Christian and Heather, for sharing all of these thoughts. It was a little bit of a fire hose, I have to admit. There's a lot of information that both of you shared. And so now we'll move into the section of this webinar where I get to ask a lot of questions. And so here we go. I think that, again, it was really interesting what you both shared. I wanted to ask first, and maybe we'll start with Heather. Do you consider yourself a data scientist? And did you start out your career working with data because you liked working with data, or you ended up working with data because you were interested in other topics and then data became a part of what you needed to work with in order to do other things that you wanted to do? So how did you end up working so much with data? Why don't you go?
It's a great question. I would start by saying I kind of fell into data. It was not a plan that I had in mind. My primary interests were really around like sport and brain health. So that's kind of why I went into psychology to begin with. And truthfully, I didn't really know what was out there in that world. And I remember coming out of undergrad actually feeling a little bit discouraged, like maybe there wasn't this exact thing that I had imagined in my mind, that maybe that wasn't out there and I wasn't going to be able to find it. But when I found the football players' health study, it actually kind of happened by accident. I had interviewed for a different position with their team, and they actually needed a data management research assistant, and asked me if I would rather fill in that role. And I just really wanted to be a part of sports medicine research in general. And I forgot to mention, so just to say, the Football Players Health Study really looks at retired former NFL players and their health after their career. So I was so excited. I was like, I'll do whatever you want. And that's really how I ended up getting involved in data, was really just being pushed into a position that was a little bit created for me in a way. And then I kind of just dove in and saw where there were holes in bodies, like it really just where they needed more people to help. And it always centered around the data and making sure that the data were clean enough to be analyzed, that the data were coming in the right way. And I kind of just said, I'll help where you need me. And they kind of kept pushing me towards these areas that data kept coming up. And the more that I worked with it, the more I realized how easy I got lost in the data. Like I can kind of like spend hours coding and look up from my computer and not realize what time it is. And that's when I started to really notice a love for something that I hadn't really considered before. I do think part of it was combining something that I was so passionate about in the sports health world with the data. But yeah, I kind of just spiraled from there. And I I just kind of kept wanting to know more, and they kept giving me opportunities to learn more. So I was lucky to be in a position where they were very excited about helping me grow as much as I was excited about growing in this space. So I really fell into it. Was not something I had really thought about for myself, but now that I'm here, I realize maybe I am a data scientist in some ways, but I will truthfully say that I spoke on a panel with the EDC last summer, and until I was asked to be a part of a panel of data scientists, I never even thought about it before. But looking back and reflecting now, I guess I guess I kind of am.
Well, great. Same question to you, Christian. Did you start out doing your data work because you were really interested in data, or you ended up working with data through other channels?
I also sort of landed into the role. A lot of my colleagues that I work with at Accenture are engineers, or have done work in information systems. So in essence, they're always sort of involved in data science for their careers. Mine sort of landed once I started my master's in health informatics. That's where a lot of data science became a more important role of the work that we needed to get done to understand and being able to leverage data to achieve health equity. As one example, I did research with one of my principal investigators on trying to understand access to dialysis treatment in Detroit, across different communities, the Black community in Detroit, which is primarily a Black community in Detroit, and trying to understand like how are they being referred by physicians. And part of that was understanding how can we leverage surveys, how can we do what kind of analytic statistical analysis are we able to drive to make sure that these results actually mean that there's a pattern that maybe the Black communities doesn't have as much access as other folks think. And so that was sort of my exposure to a lot of the work that would lead up to what I do now. And over the course of my actually tenure at Accenture is where I've been even more focused on data, where now I don't focus on data science as much, where I focus more just on strategy as well, because part of that is, again, some of these folks don't know how to leverage data science. They don't understand what is the best technique. How do I even have the data to even do data science work, right? Because fundamentally, data engineering, which is essentially helping clean the data, right? Like if you think of a set of numbers, they're not like in systems, they're all just random numbers, right? Somebody has to go in there and organize all those numbers, put them together, and then being able to have a code, like from an engineering standpoint, that could be legible, that you can actually run analytics, right? So a lot of the data isn't clean. And so my role is sort of backtracking, right? Like once I have the clean data, once I have the strategy of when I want to use it, that's where the data science has come in a lot more. And I've been able to do a little bit more work on the modeling side, such as the clean energy program, to be able to show them it's like, hey, these are the results when you have clean data. when you have a great strategy, and then you have now a plan on how you can actually be able to actualize and be able to scale, right? Because a lot of these companies have trillions of data points, billions and trillions of data points that they'll have to do at scale. So I try to do my best to do across, but I sort of landed into doing this work, and I felt such a niche to be able to help companies think this way.
Well, great. Let's dive in a little bit more just so I can better understand when you're talking about data for both of you. We'll go back to Heather for a moment. The data that you tend to work with the most, are they always, what are the data? Are they survey data? Are they medical data? Are they data that doctors and nurses provide from their diagnoses and they enter into computer systems? Or are they online surveys? You showed something called REDCap that patients enter their own data. Like what kind of data are we talking about that you use? And how many pieces of data are you talking about? Because Christian started to refer to size as well. So can you talk a little bit about that?
Yeah, so I am in a cool area of research where I've kind of been able to touch all of the data that you were just talking about. So, as an epidemiology research assistant, my main focus was survey data. So, for the Football Players Health Study, for example, we have a number of surveys that we ask participants to complete and gather follow-up data, or what we call longitudinal data, so that we can see if there are changes in our participants' health over time and what might be associated with those changes. So that was where a lot of my work at the Football Players Health Study was. But I did also work a fair bit with clinical data. So that included data from what we called an in-person assessment, where we brought participants to Boston and kind of did like a full body workup on them and looked at outcomes like pain and brain health and cardiovascular health, x-rays, all of these things. And we looked at those data as well. And so those were like the two main ones that I have the most experience in with the Football Players Health Study. It's very similar from what I gather in my new role, less survey heavy, more work with some clinical kind of medical data points. But in general, it was really cool and an incredible learning experience for me working at the Football Players Health Study, because especially in my first 3 years with them, my main role was to figure out how to incorporate the survey data with the clinical data, because obviously the surveys is where we got information about their playing history, for example. So how many seasons did they play in the NFL? What position did they play? What's their age, race, BMI? Any health outcome histories that they have, so any previous diagnoses that we should be aware of. And then how do we combine that and put that into context with the clinical data that we find from the in-person assessment? So a lot of my role initially was really taking very massive data sets and figuring out how we can kind of understand them together. And I would say tens of thousands, hundreds of thousands of data points was probably what we would work with. The Football Players Health Study is the largest study of living former players. So they have over 4,600 people who have filled out at least one survey. We have close to 200 people who have come in for some kind of in-person clinical assessment work. We have close to 3,000 people who have come back for longitudinal surveys. So there's a lot of data that we get, and especially as an trained as an epidemiologist, more data is better. We love having too much data. We can always take out what we don't need when we get to the analysis part, but there's nothing more frustrating than going back to an old survey and saying, oh my God, why didn't we ask this? Or why did we ask it in this way at time one, and then we asked it in a totally different way, but trying to get to the same answer at time two. And you kind of always reflect, one of my mentors, he always says, only God makes a perfect survey, but every time you go back, you wish that you could have made that perfect survey. So the answer is a lot of different data, but I think that's where you find the most value, at least in the work that I've been a part of.
Great, that's really helpful. Christian, back to you. When you said that companies are dealing with trillions of pieces of data? Can you say more, like what kind of data are you talking about? Especially if you go to the utilities example or the case in New York, what kind of data is so voluminous that you're working with? Can you say more?
Yeah, of course. In the beginning, I always worked with health data, so similar to what Heather worked with survey and being able to understand similar data sets from other case studies. When I jumped at Accenture, for example, in utilities, we're working with customer data. So it could be your credit score that is gathered by utilities companies, as one example. I have your name, your address, like a lot of columns. When you think of an Excel, columns and rows, and you think of, let's say, 40 columns of data about you. So your name, your last name, your phone number, your address, and then you have the rows, which is like billions of data points around all the customers that they serve across, for example, New York. So that's one example. Another example would be how much electricity you're using, data on the machine, and what the data is collecting. The number, and it's all like quantified based on a series of weekly reports, right? So you're not just dealing with one day, one set of one report and only one report full of data. It's like multiple reports of data, like how much electricity you consume today, how much you're going to consume tomorrow, how much you're going to consume the next day, et cetera, goes down the list. Because ultimately with that data, what they do is they try to understand how much are they going to pay and how much they're going to charge you. I mean, utility companies have a benchmark where you don't pay. There's a limit. There's a cap. That's a federal law. So make sure that no one's like, everyone has access to electricity. So the way they think about it is, what data can I use to lower your electricity costs so they don't have to pay as much, as one example. It doesn't sound as good, but I've also worked with other data like EV manufacturing, electrical vehicle manufacturing, and that is a whole nother data set. At the end of the day, data is data, but that different kind of data is for a different process, right? At that point, it's trying to build cars, right? So from there, I'm dealing with data from an engineering standpoint, like what part, like think of building a car like you build an IKEA table set. You have all your little parts labeled A, B, C, D, and then you have A, B, and AC, and then you have an instruction on how to put the table together, right? That is the same way they build in manufacturing. So they have to label all that data, all those parts accordingly, right? And then it has to go from the moment that it's designed. So whenever a designer puts all the sketches together of like the hood of your car, they put a label on it, like each little part that goes into that hood has a label. That's a data point. That has to go to manufacturing because they need the instructions to put that together. They need to build it, craft it, build it according to size and dimension. All of that I spoke is a data point. And so it gets very convoluted once you start dealing with like all of these like Excel tables to like different data tables in different systems, because then everyone's sort of speaking a different language. And my role is to kind of bring them together. How do we make sense of all this data magnitude and how we can actually have more efficiency on operations on building, as one example? Or how can we have more efficiency in running a program, right? Like part of a business is they want to make sure their program is successful, right? So if I'm not installing, for the utility example, if I'm not installing enough heat pumps, is that program being successful in the sustainability goals the company has? So how can we best leverage data to make sure that they are successful and we have metrics and the right data to make it successful?
Okay, well, I have a gazillion more questions, but we're at the point in the webinar when I'm supposed to open it up to other people who are listening for their questions. And I'm looking at the question box, the Q&A box, and I don't see any, unless I'm wrong, I don't see any questions that people have asked yet. So unless I'm wrong, I'll keep going with asking my questions. And if you don't want to hear my questions anymore, folks who are listening, please type in your questions. Okay, so my next question is, thank you, Heather and Christian. This is really, I love learning all this. So let's go back. You talked about data. I am curious. And Heather, when you were speaking, you were talking about the life cycle of a study, of a research study. And both of you talked about different studies. I'm just wondering, for someone who knows nothing about working with data, like how long does it take for each one of these different phases? I know every study has different levels of complexity, but I'm just curious, like when you're gathering data, how long does that take? When you're cleaning data or getting the data ready for analysis, how long does that take? Same with the analysis, same with the reporting. Can you give us a sense for just the time frame for all of this work? Heather, why don't you start?
Sure. So like you said, it can be very variable. It depends in some way about what you're asking and what you're looking for. I'll say in the work that I have been doing and in this new role I will be doing, the studies are larger and more complex enough that it takes years from start to finish. I would say that thinking about an example for one of the studies that's happening in Dr. Kim's lab that I'm jumping into now, he's been working on for 10 years. And the point is to continue to to just gather a ton of data, because more data is more power. When you can say power in statistical sense, like the actual power, but also it's just powerful in the sense of what you can say about the data at the end. But so one of the goals is really just to have a ton of data and a ton of participants to be able to look at. But for this particular project, the question is again longitudinal or follow-up. So seeing in this study's case that I'm speaking about, it's kind of like a cardiovascular health and sleep health study. So they're looking at preseason, postseason, and I believe also off season for collegiate athletes from football, volleyball, basketball, softball, baseball, men and women. How does their sport, how does their health change over time to the extent that the cardiovascular impacts the sleep or vice versa? And the value in those kind of questions is found in these longitudinal multi-year studies. So a study like that obviously takes many years he's been working on it for 10 years, I think. Kind of publishing data here and there as we see something come up, as we see a pattern kind of expose itself, you can kind of capitalize on that by publishing something. I would say for something kind of like a survey for the football players' health study, again, it's a little bit harder with that group because it's such a massive study that you're just continuing to follow up as much as you possibly can. You're not really like making a survey, opening it and closing it when you have a certain number of participants. But I will say that when we have developed surveys in the past, probably takes like, I don't know, 4 months or so to get all of the questions in the survey, get the survey built, and actually put it out for the participants to be able to take. Then you want however many, especially with survey data, hundreds, thousands of people is better than tens. And so that takes some time. And then honestly, I feel like the quickest part really is like the cleaning, at least in what I've worked in, the data cleaning, the analysis piece, because you actually have control over that timeline in a sense. And then the manuscript writing process is more so the publishing part is time consuming. Typically, you don't get accepted from the first paper that you or the first journal that you submit your paper to. So it can take multiple revisions and reviews. So that process I feel like can take 6 months if you're really lucky, but you're probably looking at more like a year once you actually have your manuscript written until it actually becomes published. So in the research world, I really do love working in research, but that is one of my struggles with it is the pace. It can be a little bit tedious and frustrating because especially in health research, what you're looking at is really valuable and could really impact someone's life and their quality of life. And not only does it take a while to actually get that out, but then what then after it gets published? You really want to get it into the hands of the people who need it. And sure, people who like doctors who are reading research and keeping up with it, yes, they need to know the current state of the research. But that was one thing I loved about the football players' health study was that we were able to take that intense manuscript, make it a little bit simpler to understand, provide some actionable steps, and get it into the hands of the people who are most worried, really, about their own health. So.
Great. Kristen, I'd love you to answer the same question, but I'm also noticing the time. We're nearing the end. So if you can give a brief response, and then we're going to launch into, unless I see other questions that pop up in the chat, we're going to launch into a lightning round after this. So how about, can you respond to the question I posed about length of time for your studies and the different aspects within them?
Yeah, I would say the consulting answer of depends. Depends on the scale and depends on how big the client wants to push it for us. I've worked on projects that would be 6 months. And by 6 months of pressure would be how much money did they give us to do in 6 months to be able to do that. And that also means like part of the challenge for us is how much openness can they provide to us in order to have access to the data. Sometimes there's a lot of hassle to be able to obtain industry data due to regulations, due to team problems or team unwillingness to be able to or like even figure out like what exactly do we need. And that could take a couple. I've seen projects that I worked on would take 2 months to get a couple data rows just to work with so that I can actually be able to build a model as one example. But generally, it really depends on the product that we're building. If we're building a proof of concept, usually it'll be a couple months. If we're building at scale, it would take years because it goes into different phases. Like one phase would be we got this data from here. Then phase two would be how can we actually build a larger model and can the product support that data? And then the third would be actually doing the go live, as we call it, essentially putting that into production and being able to be consumed by everyone at that point, right? Meaning that it's no longer being built in a sandbox. Now it's actually being out in front of users to be able to leverage and use on a day-to-day basis. So
Okay. All right. Thank you. I don't see any questions, so let's do a lightning round. See how quickly you can answer some of these questions. I'm imagining myself as a student back when, trying to learn more about this field. Okay. What skills do you feel were really helpful for you to do the kind of work that you do now? And part two of that question is, so first, what skills did you need to coming into the work? And what skills have you learned on the job to do your work? Heather.
I would say coming into it, really curiosity is the big one. But just having a bunch of questions and wanting to know the answer. And then something I've definitely developed working with data is a meticulous attention to detail, because it is very easy to get lost in code. It's very easy to think you need to do one model when you should be doing another. So attention to detail for sure is a big one.
Okay, Christian.
I think passion comes into play for me. My drive for health equity is really the passion that I always drive to my use and understanding of what's the best thing that's come out since I graduated, right? 2021 was not that long ago. I'm not gonna age myself, but since then, generative AI has come into the play, which I wish I had when I was in grad school. But that's a major component where like, how can we leverage this technology to do something good in order to achieve that passion? So for me, improving people's health has always been the precursor on how I've been able to think about how to best leverage data for these communities.
Okay. People wonder, do you need, and this has come up, do you need engineering skills? Do you need math skills? Do you need statistics to do all your work? Or is this stuff learned? Or do you need communication skills? What do you think about some of these skills that I've just mentioned and what role they play in your work? Heather.
For me, I did terrible in my stats class in undergrad. I was a decent math student, but nothing special. I was not an engineer. I had no coding experience when I started at the Football Players Health Study. And so it is 100% something you can learn. I think that Christian's 100% right, that it really comes from the passion. And with that, not being afraid to ask questions and jump into things that you don't know how to do yet. I think that was the biggest thing that FPHS, the Football Players Health Study, taught me, was just say, can I help? Can you teach me? I want to learn this. And people are willing to give you the time, especially if you're trying to take work off their plate. So
Great. Christian.
I also agree because I don't have an engineering background. I did do my master's that involved coding, and that was my entry into it. But beforehand, I didn't, and I was also in some of the many shoes of actually supporting a teacher. So I was also in the teaching realm, or that's not necessarily the same aspect of a full-blown engineer, but you pick a lot along the way, and I think part of this is where I've been had great mentors over the course of my graduate career, as well as my journey here at Accenture, that helped me understand like how do I best present myself. I mean, even working with students is a great way to like how to deal with C-suite at times. Like sometimes C-suite have the shortest attention span, and you only have 30 minutes of their time. So how do I tell them the things that they need to know, right? And same with sixth graders. So sometimes they're all over the place and don't always have their attention. So that's a valuable skill that I've been able to bring, because data is one thing, presenting data is another. And that's a skill that you have to learn along the way. And that's not something you like just learning engineering school. That's something you learn as you work with more individuals and help them interpret data for anything, really.
Okay. One last series of questions before I think we wrap up. So how much of your work are you doing by yourself in front of a computer, like with a computer program? And how much of your work are you doing with other people? Can you say a little bit more on this topic, Heather?
I would say I'm probably 85% working with other people and 10 to 15% working by myself in front of a computer. The only times I'm really truly working alone is when I am like just in the middle of code and just running stuff. But I would say the vast majority of my work is very, very collaborative. Even to figure out what analyses to do. It's all about working with Dr. Kim and getting his perspective, and working with our analyst team and getting their point of view. And there's so much integration of different fields and expertise in the work that I do. I think that honestly, that's one of my favorite parts, because I kind of always imagined this being a very head down in a cubicle kind of world, and it is the farthest from that.
Great. Christian, you have less than a minute.
Yep. No, I totally agree with that. The data space is a collaborative space. It is not meant for you to work by yourself. That's like accounting. I'm kidding. But no, I've always worked with teams. From my master's all the way to Accenture, I need to work in I am the middleman between the engineer and the data scientist. And so if I have to work collaboratively with them to make sure that we're getting the right things done, making sure that they're not quote unquote messing up, and making sure that we are collectively trying to achieve our goals. But ultimately, I never work by myself. There's always someone I work with closely to either present to a customer or client, or internally to make sure we're working cohesively.
Great. Well, I think we're at the end of the hour. So this has been a whirlwind, but thank you so much. I want to thank both Heather and Christian, our two speakers today, for sharing your insights into your work, and sharing your interests, your lives as people as well. And I want to thank everyone who attended for being our audience. And as I mentioned at the start of this hour, this was the first of a series of webinars we will hold with different data scientists, and we would really appreciate your feedback on today's session so we can improve for the future. Jen will be sharing a link to take you to a very brief anonymous 3-question survey, which will bring you to another link if you'd like to sign up to receive a certificate of attendance. And if you're interested in our teacher PD workshops and classroom curriculum materials, or our Career Hub resources for students, please visit us at datapaths.edc.org. We aim, as I said at the beginning, to have today's recording or clips of highlights posted on our website for you and others to view and use with students in the future. So thank you everyone again for attending. Thank you to our speakers, and we hope everyone has a great rest of your day. Bye.
Thank you.
Thank you.